Hey parents, Dr. Natalie Muth here. Today I'm going to tackle a question that I get all the time, especially lately. Is strength training safe for kids? The short answer is yes, absolutely. But there's a lot of misinformation out there. So let's look at what the research says. So myth number 1 is that kids should wait until puberty to start strength training. This is absolutely not necessary. Children as young as 7 to 8 can safely participate in resistance training with proper instruction and supervision. The American Academy of Pediatrics confirms that prepubertal children can gain strength with low injury risk. It's the supervision and maturity that matters more than their age. Myth 2, strength training stunts growth. There is zero evidence for this. Multiple studies confirm that properly supervised strength training does not impact growth plates or final height. And myth 3, resistance training decreases aerobic performance. Nope. The combined aerobic and resistance programs don't impair strength gains in children. Kids can do both. And there's lots of benefits to kids starting to do resistance training or strength training exercises from a young age and helping to build up the skill and expertise. They'll get stronger bones and muscle during critical development. This sets up for lifelong bone health. They'll get better coordination, improve motor skills and body awareness, and be better at sports, enhance athletic ability across all activities. And injury prevention, this is huge. 50 to 80% reduction in sports injury risk with kids who do resistance training. They'll get increased self-esteem. This is especially important for kids with overweight or obesity or body image concerns. But the benefits extend far beyond building muscle. Really, this is a great thing for kids to do. So here's some guidelines based on age and, more importantly, resistance training expertise or skill. So 7 to 8 or so, start with body weight exercises, push-ups, planks, keep it fun, emphasizing proper form. You might do 1 to 2 sessions a week. As kids develop the skill, you might have light training with resistance bands like these, really trying to build mastery 2 or 3 times a week. As they are more skilled and teenagers, you might be increasing the amount and the weight, getting to 3 times a week. The key really is to individualize based on maturity, experience, and goals. Resistance training skill is more important than their actual age. So it's really important, though, as we're doing this, to have some key safety principles in mind so that kids get the benefits and not the risks. So number 1, make sure to design programs that address all the major muscle groups: upper body, lower body, and core. Number 2, technique is more important than weight. They need to master the movement patterns before adding any load. And 3, appropriate intensity. We want to start light, progress gradually, and not lift to failure. And 4, qualified supervision is really important. Start with a trained coach who understands child development and how to do this safe and effectively. Want to wait for 48 hours between sessions, ensure proper nutrition, adequate hydration, and do not ever compromise safety. It is a priority. So let's talk a little bit now, shifting gears a little bit, about fueling these young athletes, because protein needs do increase with resistance training. So the recommended amount of protein for kids, for teenagers, is about 52 grams for males and 46 grams for females, and a little bit less for younger kids. But kids who are doing lots of resistance training may need more protein than that. So it's something to keep in mind depending on how heavy the load is, how much they're doing. Aim for about 15 to 20 grams of protein per meal or so to make sure that kids are getting enough. And emphasizing real food over supplements. So this is things like Greek yogurt or chicken, beans, lentils, nuts. We don't want to be doing lots of supplements, protein supplements, creatine, things like that. We do not recommend them. Also be aware of signs of overtraining, like persistent fatigue, decreased performance, mood changes, or frequent illness. This may be a reason to back off. This is a reason to back off. Also, inadequate nutrition, poor recovery can also be red flags. Keep a close lookout for form, making sure that there's not compensatory movements to try to lift more weight than the body's actually able to handle. Be mindful of concerns related to body dysmorphia or having concerns about body shape or type, or even signs of disordered eating or not eating enough. Okay, so key takeaways. Let's wrap it up. Strength training is beneficial and safe for kids when properly supervised. Children as young as 7 to 8 can start with appropriate programming and supervision. Protein needs may increase with increased strength training, so you want to keep an eye out for that. Focus on safety and short-term and long-term benefits, and make sure there's healthy habits, including proper nutrition and hydration alongside that weight training. So give it a shot. Let us know how it goes. What questions do you have? Drop them in the comments. Again, I'm Dr. Natalie Muth, co-founder and CEO of Namio Health.